Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Good morning and welcome to Filibuster in Fine Print, AMGA's public policy podcast, where we talk about everything public policy that's going on in Washington, D.C. I'm your host, Chet Speed, here with the all-star AMGA public policy team. While I typically come up with a question for the team, I was informed by Diva One, aka Laura Latney, that as she is producing, manufacturing, dictating this podcast episode.
Are you AI right now?
I'm always right. She has informed me that my question is out of bounds because she has her own question that I'm being forced to say. Okay, so team.
Under duress.
Yeah, it is. It's like being at home. All right, so team one, introduce yourselves, please. And secondly, according to Miss Latney, what is your favorite holiday song? And I think Miss Latney's got two.
Yes.
Which is why.
Yes.
Of course she does.
Yeah. Which was also written into the script. Yeah.
It's very self-deprecating.
So this could take a while, dear listeners. So Alicia, why don't you start?
Hi, I'm Alicia Foyer. I'm the government relations assistant.
It's her name.
I was like, I have to think of the song now.
Oh, that's right.
I'm just gonna say anything Mariah Carey.
Well, that's good.
Yeah, that's good.
Yeah, mhm.
I just break her out every holiday season, and then in January I pack her away.
Yeah, she is the queen of Christmas.
Yeah.
Yeah.
She makes some good coin at Christmas.
Yeah. Only Christmas.
Only Christmas.
Yeah.
She had an album coming in September. No one talks about it.
Miss Latney goes last.
Oh, you
Darryl?
thumb up. Hi, everybody. Daryl Drevna, Senior Director of Regulatory Affairs. Favorite Christmas holiday song. It's really cheesy and fun, but it's Snoopy's Christmas by the Royal Guardsmen. It's Snoopy fights the Red Baron, and they have a truce, and
Yeah.
So it's fun. Yeah.
Is there singing in it?
Oh yeah.
Oh, okay.
Yeah.
Well, you
Merry
said there was
Christmas,
a
my friend.
fight.
Merry Christmas, mein Freund. You know, German. Yeah. Look it up. It's a good
Okay.
time. Yeah. I'm sure it's top of Spotify right now.
Oh, absolutely.
Jamie Miller, Ambassador Goodwill here at AMGA. Backstory on this is this artist was in a high-speed chase in my hometown in the 80s, and I just remember he's got one of the best mugshots of all time. His name is James Brown.
Oh,
And there's a song called Santa Claus Goes Straight to the Ghetto, and it is really good. So I would highly suggest it. It's a really good song.
That's
I
a
can
good
see
one.
his picture.
His
Yeah,
hair,
yeah,
his
yeah,
hair
yeah,
is
yeah.
just his hair.
Go watch old interviews of James Brown in the 90s. A lot of fun.
Yeah.
You know, James Brown used to come to D.C. to do fundraiser concerts for Strom Thurmond. Senator Strom Thurmond.
Joking me.
They were friends, and he would have Brown come up and do a concert in D.C.
Christmas miracle.
Yeah, that's
absolutely.
so. Yeah, Strom Thurmond, and because James Brown was Georgia, South Carolina, he lived on the border in Beach Island, doesn't matter, but he lived, which is not an island, but it's near Aiken, South Carolina, and that's where James Brown spent a lot of time.
We can stop right now.
Yeah.
That is
That was-
unbelievable.
Yeah.
We're not going to, but
No, because this is
It's an
Lauren's,
Lawrence show.
this is Lauren's podcast.
Damn it, Jamie! Stop giving good stories.
You're over your allotted time.
Mike, I please edit out Jamie because
we'll talk about it off the recording.
Miss Latney.
So my favorite is Donny Hathaway's "This Christmas" because I am a Black person, and that is our national Christmas song. And anytime I hear it, it just brings me a lot of joy.
Good.
And I feel like it's eternal. Like I'll listen to it. I feel like it can be in any time space and it'll still work. My additional one, and this goes out to my best friend, is Bruce Springsteen's live "Santa Claus is Coming to Town."
That's really good.
Because he's so drunk in it. He's like, snow on the beach. Hey, man, have you been good this Christmas? Well, not many. And it's just like, it's so funny to me. So that's why I wanted to include it. Because he's feeling very merry and bright in that song.
Very merry.
That's where he's like really rich too. That was the 70s.
Oh yeah.
I remember. Yeah.
I kind of was like, is this where Barack Obama got his voice cadence? Because it's
Oh my God, I can't unhear that now.
Drunk from Springsteen.
little Charles Springsteen. Yeah. So what's yours, Chet?
Oh, yes. Well, so Margaret would dance with Barkley when she was 6 months old to Mariah Carey's "What I Want for Christmas."
Aww.
So that's still ours, and it is fun to watch Margaret try to dance with Barkley now at 14, and she's like, Barkley's like, no,
I passed.
we're good, yeah. Just wait, my guy. 14 years, be at the same place.
Yeah. What's your song, my guy?
Yeah. We have to.
All I Want for Christmas.
Oh, so,
Yeah.
We got 3 Mariah Careys. Yeah.
It is a good
It's
one.
a good one.
Yeah. All right.
It starts the season.
It does.
It does.
Yeah.
All I want for Christmas is this podcast. Okay, that's terrible. Okay. That was so bad.
That was
Turn up
cute.
the volume on that part of the podcast and editing, please.
Edit that one
That
too.
can stay.
All right. Well, on today's very special Lauren Latney directed dictated podcast, and we're going to break down AMJ's public policy top 10 issues and accomplishments for the year, and we're going to vote on what is the number one. And Lauren could have picked it herself because this is her podcast, but she said no. She wants us all to vote on it at the very end, and she says in her outline, "Let the chaos commence."
But
as
doesn't
we
she
go
have
through-
final edit though?
What's that?
She has final edit. She
Of
can.
course she does.
Right.
Right.
I guess just to start by saying, just as a general rule, if Jamie says something, I automatically go opposite of that.
I agree.
So,
we know that.
I feel like that's a good workplace environment.
Not for the rest of us.
We're lobbyists. We have to fight.
It does become a management issue. All right. So the top 10 list for AMJ's Public Policy Department in 25. Let's start. Now, we'll start at number 10.
number 10.
The bottom.
Ooh,
The
number
bottom,
10.
Which is, of course, a reg issue. So they're all
Right.
Putting Diva
Like
2 in this place.
Barely making the cut
Here's Daryl Drebner.
is number 10. Our success with the FTC's non-compete clauses and non-compete regulations. We have opposed FTC's non-compete rule from the beginning and maintained our opposition throughout the rulemaking process. We've argued that state authority should be prominent here. Individual states are the most appropriate arbiters of non-compete agreements. They're familiar with the local markets and conditions. It got really, really quiet in here all of a sudden.
Yeah, it got really exciting.
Yeah, exactly.
Oh,
Everyone's
I had to listen.
pivoting.
Intently.
You know, AMJ members invest a lot of time, energy, and resources into recruiting and maintaining, a physician staff. And, you need to have an opportunity to recoup some of those investments and the costs associated with it. So that's really why we were opposed to these non-compete agreements. That and, there's a care coordination concern. Patients benefit the most from care coordination and team-based environments. Patients need access to a team of providers, and that's important for care continuity, especially for chronic diseases. So right now, this non-compete agreement is not in effect, not enforceable following a court ruling. The FTC put out an RFI not so long ago asking for comment on this, and we reiterated our concerns. But as of now, I think we can put a win on the board that these are FTC's plan is not enforceable.
All right. And that was a good win. Yeah, great. Okay, number 9.
Happy to take over now. AMJ members driving the conversation. So number 9 is all it's focused on our engagement, our Capitol Hill Day,
Focused
Grassroots
on you.
Network, DAP. Yeah, all the things that I do.
There we go.
And so for Capitol Hill Day this year, we had 57 attendees, which is our highest attendance in the past few years, at least since I've started. And we had 154 total meetings scheduled for attendees, and 17 of those were member level meetings. Nothing to sneeze at. And then our Grassroots Network. We've got a webpage now. Thank you, Mike I.
Yeah, and Mike F.
Yay,
Mike
I,
F.
shout out.
Mike F2.
Mike F.
Mike F2.
All the mics, thank you.
Yeah, all the-
And our grassroots network is just so important. It helps with those introductions to lobbying. It's the easiest first step. It helps you build a lasting relationship with all these touch points and opportunities, and it really amplifies our lobbying. Congress, they like to listen to you more than they like to listen to us.
That is actually true.
Yeah, and it helps convince Congress when the constituents are there advocating themselves, you know? They're like, okay, so you say so, but what do they really say? And this is your opportunity to get to say it. And then I'm pleased to give a brief overview of the DAP program and our 2026 campaign. We'll be pivoting a little bit and moving to focus on the district directors and working with district staff. The district directors and staff are the ones who are constantly on the ground connecting with folk in the district. Folk. Yeah. And members of Congress often have roundtables and kitchen cabinet meetings with local leaders when they're in town. And getting to know the district director is a way of creating even tighter bonds with your member of Congress. And these tighter bonds can lead to greater congressional relationships.
Yeah, and that's a really good idea. The district director basically is the member of Congress when the member is in D.C.
Yeah.
And an immensely influential person and good person to know. And we did talk about the need for us to continue to partner with the members because we do a great job lobbying. Jamie, Lauren, and Alicia are outstanding. But when we partner with you all, we're actually much, much better. So number 9, thank you, Alicia. Okay, number 8. Ooh, new federal regulatory issues.
How is this number 8? But okay, that's fine.
Well, Lauren actually.
Yeah. Let's see. Let's see who wrote this list. All right. Number 8, new federal regulatory issues. We expanded our portfolio to respond to the needs of our, very diverse AMGA membership. And, you can look at this in a whole different way. I think the biggest issue we started taking on this year, and this could be a legislative or regulatory issue, is Medicaid. Making sure Medicaid provides the resources and revenues and reimbursement, I should say, to our members who are treating the patient population here. So, and that could look at a whole slew of issues under the Medicaid heading, whether it's state-directed payments or provider taxes and that sort of thing. So we're starting to advocate on behalf of our members for those issues. We also have issues like the outpatient reg. Historically, we've never filed on the OPPS. We did that this year, and it's part of our expanded portfolio of issues. It could be things like the drug acquisition cost survey or ensuring that the outpatient payment system is adequately reimbursing our members for the care that's delivered there. 340B is a new issue for us too. So making sure that the program, again, this really comes back to sustainability, which we're going to get to later down on the list. Making sure our members have the resources they need out of the various payment systems, whether it's Part B or Part A or coming out of the Medicaid program, that they have the resources they need to deliver the most effective care as possible. So I think that's our expanded portfolio in 2 minutes or less.
Okay. And I do believe you're going to double up because you had number 7 too.
Number 7 too.
Yeah,
I'm
so keep going
over this list. So it's really not where you are on the list; it's that you've got more of the list.
Yes, more than everybody else.
More of
love
the
that.
list. Yeah.
That's why I deal with one and two.
Exactly.
Sit next to each other.
Exactly. So immediate resulting. This was an issue that came to our attention really from our membership brought this up, and it comes out of Cures Act and information blocking regulations out of Office of National Coordinator. And the issue here is anytime you have a lab test or some sort of medical test, those results are going to get immediately, as soon as they're available through the patient portal, you're going to get notified whether or not your clinical team and physician has reviewed them or not. So you might not be getting those test results in the context that they need to be delivered in, or in the most compassionate. They might not be delivered to you in the most compassionate way as possible. So you might find out that you have a life-altering condition through a push notification or a text alert, that sort of thing. So we've been in conversations with the regulators over at ONC, and they're sympathetic to our concerns. We're working with them now to maybe update the regs so they incorporate an exception or a way to delay these results to accommodate or recognize the emotional or mental harm that could be caused if you're getting these results without the proper context and without the clinical care team reviewing them and delivering them to you in the most compassionate way possible.
And that is a great patient issue.
Yeah, no,
and I hope we're successful.
Me too.
Yeah.
So we're continuing to work on this. Had some really good conversations. I know there might be a legislative avenue here as well. So stay tuned. But I'm really optimistic this is something in 2026 that will, make this list again as a full-fledged win.
Health staff are really excited about it because it's so niche.
Mm-hmm.
They've not heard about it before. A lot of them did not work on the bill that originally created this as 21st Century Cures. So to see their sort of faces light up of like, oh, I probably have had this experience, and also I did not know this was something that was going on. Mm-hmm. It's been great.
Yeah, and it's awesome. As Lauren gets into Daryl stuff.
It's such a little
Well
bit.
played.
Yeah. She's
Okay. Number 6, Miss Sawyer.
And I'm back.
Yay.
So we launched new AMGA policy issues as well as adding to our regulatory portfolio. And as Daryl mentioned, we added on protecting Medicaid funding.
Mm-hmm.
We added extending, and now Daryl didn't add this. Now I'm adding this. We're advocating to extend the expiring enhanced premium tax credits, improving the 340B drug pricing program, and strengthening graduate medical education. And these were added earlier this year in response to changing political environment and focus, and as Daryl mentioned, of course, our diverse member group population and members' priorities. And I think this really demonstrates our ability as an organization to pivot to address what's at the forefront.
Yep. I agree. No, we took these on and very quickly, and I think we did a good job on them, so that's great. Thank you. That's number 6. Number 5, Mr. Miller.
So when it comes to Medicare, this is probably the biggest money-wise policy we worked on through the years. It's called pay-as-you-go. Every time Congress passes a massive bill like OB3 this summer, they spend money, and they did spend money to pay for certain tax cuts and other things, inlays for the government. And what they do is they have PAYGO come in at the end of every year and say, well, this much money is over budget and we need to make cuts. So what we did was we worked with Congress to waive this PAYGO, and it would have cost Medicare and Medicare Part A, B, C, D, $45 billion. That would just been on top of all
A year
per year. So that's more than significant. And so we appreciate the work we've done with you all to make sure that, because there's sometimes members of Congress like, I haven't heard from anybody on this. I'm like, well, you should, and this is a problem. And Congress heard from us, and we appreciate you all reaching out.
And outstanding. And now we're at number 4.
We're going to talk about how we, for the first time, took on Medicaid.
Mm-hmm.
It's one, as Alicia mentioned, it's one of our new issues. This was approved by our Public Policy Committee, shout out, for reasons that really matter, which is at the top of Congress, everyone was talking about reconciliation and how do you extend the current tax cuts that were happening under first Trump administration, and to pay for those, they were going to use Medicaid, which is the first time we have used like a program, a healthcare program, to pay for something that is not healthcare. Mm-hmm. And so in order to address that, we launched our Stop the Cuts Medicaid campaign. And one of the things that I think one of the things I'm most proud of this department is we launched our Medicaid cut survey, which we were asking our members before reconciliation was even, as the debate was starting, what are some of the things that could happen if these cuts go into place? And it was a pretty robust response. And we showed this to members of Congress, and they're like, how do you know? Like, you don't know there are going to be cuts to Medicaid. And we're like, we read the news. What are you talking about? And so they can't say they did not have the data.
They had it.
And they had it. And then when you look at like Kaiser Family Foundation, all these other surveys, like our numbers pretty much match up to what was happening post reconciliation. And so really excited because next year we are going to do this again. We want you to participate even more. And you think about some of the things that happened under reconciliation, which were terrible toward Medicaid, but you think about it could have been per capita caps for people. There were also these other programs that could have been cut. And so having a campaign where there was damage, but we minimize some of the damage, I think is really important, especially as we gear up for next year when we really go hard when we talk about stopping these cuts.
Yeah, well said. Okay, now down to the top three.
Top three.
Are we ready?
I think so.
Okay.
Yeah.
All right, let's go.
So this is the debate of how we rank these. So I'm next.
How we.
Well, I will say Lauren asked me which one do we want to argue, and I was like, I don't care. I just want to go against you.
So and Daryl
team cohesion.
Team cohesion.
Well, I would say for those of you who have teenagers, make sure they do Model UN, Lincoln Douglas debates, which I did. That's one of the many reasons Lauren's so good is she did Model UN, and I did Lincoln Douglas debate. I think it's really helpful.
He humble brags.
Lincoln Douglas debate.
Lincoln Douglas debate.
Which is vastly cooler than Model UN.
I don't think either one is cool. I'll give you that.
None of them are cool. You look at the pictures that are like, oh gosh, I'm such a nerd. All braces. It's terrible.
Ooh, no.
So the top three are we can discuss ranking. So one of the things that we saw a somewhat success is that we saw an extender for telehealth waivers. We also saw active play in the hospital at home program, and then the elimination or pause on the Medicaid dish cuts. The government shut down for a while, the entire month of October, and then came back in November to do a very brief continuing resolution, which is basically we'll still pay for the programs that are already in place. And one of the things that we have been actively talking about for years and have been endorsing a lot of bills on this is telehealth waivers. We are hearing from our members just how impactful having telehealth access for Medicare patients is. And so this has been extended to the end of January next year.
Yep.
So we're going to be right back on it when we get back after the holidays. We also have the hospital at home program. This bill passed in Congress, House side, and extended for 3 years. And we're hoping that the Senate takes up this bill before the end of the year. This is a free program. Congress likes free things.
Yes, they do.
And so this could be an easy win for them and for us. And then there's also a delay in Medicaid dish cuts, saving about $8 billion. And of course, we'll have to debate that again next year.
Yep.
But for now, there's a little bit of pause. So that's one of the candidates for number one.
Okay. All right. Next.
I would say the foundation of Medicare Part B is Medicare conversion factor, and that's a potential patch that we have to do every year. And this summer in July, Congress passed a 2.5% patch. It was over $1 billion to maintain. And I know we've heard Daryl present in the past about how Medicare is not keeping up with inflation. And one can argue without this 2.5% patch, the hole would be even bigger. You have to dig yourself out of. So this is something that's helping patients get access to care, and obviously you get the doctors. This isn't about doctor comp. This is about being reimbursed for the services you provide. So every community in this country that takes Medicare Part B is going to have better access to care. So beat that.
Well,
I really like the title that Lauren gave Jamie's. It's Fixing Medicare One Conversion Factor at a Time.
Yeah. Well, then she has like 4 bullets explaining her point. Yeah.
For me,
and then mine is like nothing.
You got it.
Make it up.
You're a group practice lobbyist.
I got it.
You shouldn't need to.
I don't. You should have put something wrong in the bullet point, so I would have said it. Like Ron Burgundy.
Wow.
Yeah, there we go. Nothing spells Christmas like a curse word.
Yeah, no.
Okay.
Curse word.
Borderline.
So number one.
Edit that out.
Yeah, we'll bleep it.
Yeah. That's not exactly what he said either.
Okay. One.
So yeah, I think it's really interesting. We've got these like short.
Not necessarily one, sorry.
But
It's one of the top three. Right. When I said one, Lauren gave a look. So. Sorry.
I could argue this a couple different ways. So the future of what Medicare Part B is going to look like. So instead of a series of short-term fixes, shots fired. Yeah.
You're right.
He is right. I'm sorry.
Like, oh, maybe the first one I said should be number 3. So we got to go back here in January.
Yeah.
I've talked myself out of it.
Kidding aside, like those are some serious wins. Like with the way Congress is functioning, or not, however you want to characterize that, you are able to, get a PAYGO delay and get these extenders passed in a really tough legislative environment, and getting a conversion factor put in when you've got members of Congress who think physicians are frankly getting overpaid, even though it has nothing to do with that. Yeah. To secure those wins are huge. So we're going to take that, and what we're trying to do with this other option is our MACRA Value Task Force that we've been working on for the past couple of years, and we've got a whole printed report, which I think should put you up in the rankings a little bit, but that's neither here nor there. And it's built around 6 pillars, right? Patient engagement, health outcomes, ensuring rural and underserved practices have the resources and support they need, regulatory relief and reducing administrative burden, addressing end-of-life care. We're really excited about some of the ideas we have about making sure patient wishes and dignity are respected at the end of life, and then ultimately making sure the payment system is sustainable for both our patients, providers, and the program itself. So we've got this really exciting, I think, our task force report, which is sort of soft launched at last Capitol Hill Day. We're going to do a whole big rollout early next year, probably once Congress gets back after January 30th, and let the dust settle from that. So we're really excited to officially launch this task force report and all the ideas that are in it. So yeah, I think we're really excited about it. But to be fair, it right now is all theoretical. So
that's what I was thinking.
Yeah. So yeah.
Right.
Yeah.
We are at 26 minutes, so we got to vote. We need to vote.
How about you decide?
You're the decider, President Bush. President Bush, the decider.
As part of management, I love all of you all equally. So I can't.
Well, Alicia's going to make Alicia has to make the vote. We're all going to vote for ourselves. Yeah. So it's your choice, Alicia. Remember to write your review, though.
Who are your guys?
This is not on video. Video comes next season.
Yeah. And another microphone, allegedly.
I vote for Daryl.
The coach.
Well,
I was really nervous to say that.
Well, you should have been.
Yeah.
Well, then I vote for Lauren, so she wins.
I was going to vote for Jamie's, actually.
So
Actually, I was going to vote for number 9 at Alicia, because our member engagement really drives the train here.
That is
Thank you.
That is true. We have a usurper.
Yeah.
Like most discussions in DC, there's no actual conclusion.
Yeah.
So we have a top 3 plus 9. So there we go. All right. And we are 27 minutes. This is our last podcast for the year.
Yeah.
So thank you, team. Y'all did a great job on the podcast, every day at work. Thank you very much. To the members who listen, to the members who are who are members of AMGA.
No, only the ones that listen.
What's that?
Only the ones that listen.
Okay, wow.
So how are they going to know?
Yeah, that is true. For those AMGA members that listen, it's been wonderful working with you all. We actually partner with you really effectively, and I hope you all have a great holiday season, Happy Hanukkah, Merry Christmas, and a great New Year. And we will see all of you in 2026. So that's a wrap. Thank you all.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.